WAOH is brought to you in part by Ohio's #1 trusted real estate team, The Young Team, online at theyoungteam.com.
Welcome back as we continue our series focusing on the work happening at Summit County Children's Services and the tremendous need in our community for foster parents and for those to step up, support kids in need, and for all of us to support the great work that the folks at Summit County Children's Services are doing. And right now we have Traci here joining us on the set. With placement is your role. Talk about your role at Summit County Children's Services.
Yeah, good morning, Dan. Thanks for having me.
Absolutely.
My role at Summit County Children's Services is I'm the Department Director over Placement Services. It's one of 5 departments in the social service side of Children's Services, and I oversee several programs including foster care, licensing and maintenance, kinship care, assessments, and placement. We manage outside provider contracts, so those are those private agencies who also do licensing and placement of foster youth. We also place in those homes. So I manage those contracts. I manage family team decision making. And so those are meetings that we hold when we want to bring the families to the table to discuss it, whatever concerns that have brought us into their lives. So I manage that along with our family search and engagement. That piece is really diving deep into a family's background to find kin family that can take placement or provide support. And they don't necessarily have to be a relative. They could be a non-kin or a very good friend or close friend to the family who can provide that additional support. We also have independent living services that we also offer that fall under my umbrella. So really all the supportive services that we can provide to families and our agency is what's housed under mine.
Independent living would be for maybe kids that were in the care of Summit County Children's Services that have reached an age where they can live independent.
Correct, yes. It is for youth who are 14 and over who are in our agency's custody.
Let's speak to the need for foster families, and I'm sure that your service providers that you would go to because maybe we're in a crisis or maybe there's more kids in need than there are foster families. So you would oversee service providers and describe what that is. There's organizations that step up and help, and what are those organizations and what do they do?
So the need is really great. So in the United States as a whole, we're really struggling with this crisis because we have more children who are in the custody of county and state agencies and not enough foster homes. And it's, acutely occurring in Summit County, particularly. And we have approximately 40% of our placements are with kin. So that leaves the rest of the 60% who are in need of foster homes. So there is clearly a disparity between those numbers. And, we've started off back 5 years ago. We were in the high numbers, 170 plus foster homes. And we are now down to about 130 approximately family foster homes. And we are running at about 800 plus children in custody at any one given time. Within the last 5 years, we were up to as high as 908 children at any one time. Again, so when you only have 130 foster homes and you have over 800 children in custody, that clearly speaks volumes. And a lot of these homes can only take 1 to 2 children at a time. So, certainly you're looking at maybe a third, if not even a quarter of the children that we have in custody are in our own family foster homes. So folks probably are wondering what happens to the rest of those youth that need placement. We do look to private network providers is what we call them. So there are several private agencies, multiple private agencies in the state of Ohio that we contract with for placement into foster homes, into family-like settings. When those youth can't be in a family-like setting, then we look to either a group home type setting or more restrictive, which would be a residential treatment center if those children really need some higher level of care, mental health, behavioral health, developmental issues, you name it. That's where you might find some youth who are in residential. We, fortunately, in Summit County have a pretty low number of youth who require that level of care. So a majority of our youth are in our what we call provider network home, foster homes and family foster homes, followed by our kinship and then by our Summit County Children's Services foster homes.
Without taking away from the work that our service providers are doing, because I'm sure they're doing a phenomenal job, the benefit to the child, a child in need, to be in a home with a family, or not in a group home setting, but in a residential setting with foster care that is perhaps more one-on-one, or maybe other kids in the home, but with a family, there's a benefit to that. It's a better situation. It's the situation you would like to seek out for more kids that are in need. Describe what those benefits are versus maybe a child being in a group home, being able to be with a foster family.
Sure, absolutely, Dan. So we always want children to be in a family, specifically their own, of course. Children grow best in their own families. However, when that can't happen, the next best thing is to look at relatives or non-relative kind of families. Again, looking at the family system, you want to make sure that youth are still with family. If they can't be with their relative or people they know, then that's where the foster family, again, that family-like setting is really key, because they learn healthy relationships. They learn healthy boundaries in families that are safe and that are healthy. They feel that connection, or start to develop that connection if that's not present. We've learned that they are able to focus better in schools, when they're safe, and be able to attend school, be able to meet their health and mental health needs. Whereas, in a group home setting, well, they're likely with peers. However, sometimes those relationships aren't healthy, and they're not run like a family. It's more of it is congregate care, right?
Sure.
So it's vastly different than being in a family and being in a home that they can go back to when they come home from school, or when they go wherever, right? And they have that family to come back to.
Somebody watching this right now, maybe somebody that's been paying attention to our series on becoming a foster parent or learning about being a caregiver through Summit County Children's Services, speak to the impact that someone who decides to step up and become a foster parent, the impact they have in the child's life, certainly in our community, that we are in a crisis, that becoming a foster parent, and even just taking temporary placement, becoming certified so where you can step up and assist, has a tremendous impact on Akron, Summit County, and most importantly on these children's lives.
It really does. And one of the most impactful things is if we can find families and place children in the same community where they came from, and then are being placed back in. And when we can do that, and when families step up in their communities, individual communities, and we can keep those youth in their community, it keeps that connection. It keeps some sort of normalcy for that child, because we won't have to change schools. We won't have to change perhaps other medical providers or those kind of things for that youth, to try to keep things as normal as possible. Another impact could be is developing the relationships with the birth family. And just because they can't be with birth family at that moment, if the foster family develops that relationship, that is so impactful and really helps with reunification. It helps kind of bridge the gap, so to speak, is what we talk about, in that it makes it smoother for the child, because they see it, they can see that relationship and that support to their parent, and perhaps to themselves. And when the child is then reunified, again, the foster family could remain that support to that birth family as they continue to raise that child together. We have many foster families who often talk about, once they take a placement and a child is reunified, that they've gained another family member, and they grow their family, and not by biological means, but through the fostering, and it really does become quite a great big family. And you can't even speak to the impact of that. I mean, it's so great, and it's to change somebody's life, really, not only the child's, but the foster families and the birth families, is something beyond words.
We're educating our audience on the whole process, becoming a foster parent, what Children's Services is doing to serve the community and serve kids in need, but really serve families in need. And maybe one thing that's lost is just how much work you put into the case plan for a biological parent who's fallen on a difficult situation or has made bad choices, and they're in what we would hope would be a temporary, where your services help the biological parents or the family with the goal of reunification to work the case plan. There are a number of services and resources that you're offering to help them get back on track. And so there's just as much work going on there as there is support for foster families. And it takes all of us working together as both of these things are happening. And maybe that's one thing that's lost, is the resources we have for families in need. And just because they, as you said, the child can't live with them for that period of time, that the goal is reunification. And speak to that. How much work is going on in terms of helping biological parents and families work through difficult times?
Yes. And that's our goal, right? That is the mission of our agency, is to try to make those situations safe for children to be in and stay in or return to. And so we connect families, birth parents, or whoever that child's going back to or trying to maintain in whichever home. We make connections with various mental health, substance use, counseling resources. Could be housing, it could be anything that they would need to address those needs. And the crisis that we have in foster care is really linked to a lot of those things, right? The opioid pandemic that
Sure.
you've often heard about, mental health crises and concerns that our families get involved in, as well as just family dynamics are really much more complex these days, I feel, and all of that together really needs to be addressed. And our caseworkers are doing the hardest work to try to get these families on board. A lot of these concerns and issues that families face are either generational, that have been going on for years, that is really hard to change pattern or change course for someone to do, and it could be lifelong. And so, again, with that foster family, making those connections with birth family to be able to maintain connections and support especially will help that biological family or family member be able to stay on the right track, or at least get that support to help them when they need it. And again, with the children, that's even more important too, that foster family is there and continues to be a support.
Well, under the difficult circumstances, an optimal situation in these challenging circumstances would be if a child can go stay with a family member. And the kinship program has changed over the years to the point now where there's a financial stipend to be able to support families who take in blood family members, or maybe a non-blood, as we call it, the non-blood next of kin.
Yes.
Placement, sort of. But why was that changed? And what you described earlier, the work of reaching out to find family members. I would almost be curious to know, do you ever find family members that didn't know?
All the time.
All the time. I had no idea.
Yes.
My nephew, my niece, my grandchild was in this situation. I haven't talked to them in quite some time. And maybe family members hide in a way out of embarrassment, or just they feel like a failure, or what, they don't have the support, whatever their personal circumstances are. But you find family members, and the kinship program has changed to support family members who take in.
Yes.
Describe why that happened.
When we take pride at Summit County in placing children with family and non-blood kin, as you mentioned, family members, because again, if they can't be in their own biological removal home with their birth parents or whoever they were placed with as family, then the next best thing is their family, kin extended aunts, uncles, grandma, grandpa, whomever, even cousins, second cousins, we find. We've even found non-blood that consider themselves aunt, uncles. And a lot of times they don't know because of all the reasons you mentioned. Birth families may not disclose what's going on with their personal situations at those times. And sometimes those kin can take placement, are willing to do that, and sometimes they're just there for support. So whether they help with transportation to and from school, to and from medical appointments, whatever the case, visitations, are they able to help in any regard is what we really look for. And we make multiple connections on each case every single day. I feel like we're always finding that. And I think that speaks to the rate of placement in our kinship and non-kinship homes, which is 40% or higher at any one given time, so of all the children we have in placement. So I think that's, a really great statistic to share with our folks out there in the community, because we do take so much pride in that. And that continues throughout the case. So even if a youth is placed into a foster home, we continue that family search until we do find somebody that is appropriate and can take them. Because we value that so much, and we understand how important it is for children to remain with family. Because even when children move around, that is so disruptive to them. There's so many implications about moving and what that does to a case, what that does to a child, and even their families in general. It hinders reunification. It could take longer. But some of the changes with kin that have come into play in the last several years is, you talk about foster care licensing. Well, now in the state of Ohio, we are able to waive certain criteria that traditional foster families have to do to become licensed. We can waive that for kinship foster families. One of the big one is training. There's about, I think it's now 24 hours of training we have to do for a traditional home, and we can waive that for the kinship families. Lots of times when kinship families become to the stage that they want to become a licensed foster home, they already have placement. So we're trying to remove some barriers in that process. And training, that's one less thing they have to do. Any other non-safety things we can waive. So another one might be getting medical records that we otherwise would have to get. We don't have to. If we don't feel that there's a significant issue there, we can waive that kind of a thing. We still have to go through and look at the home and do the fire inspections and all those good things for them. But there are several things that have made the process much easier for them. At Summit County, we also pretty much walk them through the process. And that's either traditional or kinship, which helps make that go a little quicker. And we're now licensing kinship foster families about within 90 days of application. So, and that provides them support financially, because now we're able to pay them each day to care for their kin. So they get a per diem just as traditional foster families get. Wow. So it's pretty great.
Let's wrap up with a revisit of the numbers and the crisis. And it's troubling that how many kids are in need in Summit County, in Akron, in your care. Run for us the numbers again of kids in need here in our community.
Yeah, so currently right now we have over 800 children in custody, and that changes every day. It goes up and down depending on what happens each day. We've been as high as 908 in the last 5 years, and right now is probably one of the lower times, to be honest, of the numbers that we have seen in the last 5 years. We've been pretty steady at about 850 children, give or take, and we're at about 130 foster homes in Summit County. And that's through Summit County Children's Services, which we certainly need more of, because that is not even coming close to, having a home for all those children who are in need, which is causing us to go outside of our own network, and a lot of times out of our own county.
The greatest need I'm hearing is in Akron, in with it, we're here in downtown Akron in our studios, and let's say a 15 to 20 mile radius that is the greater Akron area is where we need foster families,
Yes.
so that kids in need can stay in their schools, can stay in our community, and as parents work through case plans, we can work to reunify, support the families in need.
Yes.
Okay. Well, thank you for taking the time
Yes.
to share with us, and thank you for watching as we continue our series spotlighting the great work that the folks at Summit County Children's Services are doing, and really putting out an appeal to anyone who might be inspired to consider stepping up and becoming a foster parent. There is certainly a great need, and if our program can help to encourage someone to at least become educated and take a look at the idea of fostering, then our goal has been met. Thank you for watching, and we'll see you on the next one.